Liz, I'm Megan. I'll be your physical therapist today. Okay, so what we're going to do today is a little bit of massage to your knee. So first I'm going to go ahead and wash my hands. Perfect. Okay, so you have your patellar tendon, kind of sits right here. What we're going to do is I'm going to apply some deep friction massage. I'm going to push pretty hard along this tendon. It might be a little uncomfortable. If it is uncomfortable, that's normal. I just don't want you to have pain. So if you start to have a lot of pain where it's shooting down your leg, or you feel really, really like you're gonna cry kind of pain, let me know and we'll stop immediately, okay? I do need to ask you just a couple quick questions first. Do you have any known infections?
No.
Okay, do you have RA?
No.
Or rheumatoid arthritis? Or do you know if you've ever had any bursitis in this area?
No.
Okay, perfect. So what we're gonna do is, that deep friction massage, but why we're doing it is to help align the fibers in the tendon, decrease any adhesions or rough areas, and increase the mobility if you do have any scar tissue in there. Okay, so I'm not gonna use any lotions. It's gonna be just my finger on there, okay? So we're gonna do this for about 6 minutes. I'm gonna get started, and I'm just gonna come back on this side, okay? So we're going to keep your leg nice and propped up. Just try and relax the best you can. So we're just going to go right across the tendon. How's that feel?
Good.
Enough pressure?
Yeah.
Okay. We're going to do this for about 6 minutes. Kind of working all the way up and down the tendon. This is something you can do at home as well. So what you're going to do is you're just going to go sideways, just right across that tendon. How you doing?
Good.
Good? Okay, so that was 6 minutes. Physical therapist today. How are you doing?
Good.
Good. Okay, so what we're going to do is I'm going to work on your shoulder a little bit. Essentially what I want to do is kind of find out what motion you have in the shoulder itself. So we're going to do something called joint accessory mobility. So I'm just going to kind of push on your shoulder a little bit and kind of feel around which ways are tight, if anything is tight, okay? So I wash my hands. Alright, so what I'm going to do actually is called a posterior glide. So I just want you to relax your arm just in my hand, okay? I'm going to take full control. And I'm going to push down, kind of push your shoulder down towards the floor, okay? So if you feel any pain at any point, let me know. So we're going to the point of tissue resistance. And then just a little after, give a few oscillations just to see how it feels. Okay, so we just tested your right side, so your uninvolved side. So now we're gonna try your left side to see if they feel any different or if they feel the same. Okay, so we're gonna do the same thing. I want you to just gonna take your arm, stay nice and relaxed. Find your space here. And we're just gonna push to tissue resistance and then give a little bit more. Try again. Okay, good. Feels the same. Okay. Hi Liz.
Hello.
I'm Megan. I'll be your physical therapist today.
Okay.
So what we're going to do is, I see you're already in position here. We're going to do some joint mobilizations, they're called, on your left knee today. So I see you're having some trouble extending your knee or straightening your leg all the way completely.
Yes.
So we want to try and increase that. So what we're going to do is I'm going to do something called an anterior glide. And essentially what I'm going to be doing is pushing your leg in a certain position to extend the joint capsule that is inside your knee. So we're going to give that knee some room to move around a little bit and hopefully get your leg nice and straight today, okay? So I'm going to go ahead and wash my hands and then I'll be right over and we'll get started. Wash. Alright, so I'm back from washing my hands. So what I'm going to do first is, so I explain the procedure to you. So I'm actually going to test your right leg first before we start anything on your left leg, just so that you can see how it feels and so I can see how the joint feels in my hands, okay?
Okay.
So what I want you to do is just relax. Get my stool over. Just relax your leg right into my hand here. Okay? And I'm just going to use kind of the palm of my hand, and we're just going to apply some force just to see what that joint feels like. How's that feel?
Good.
Okay, so we're going to tissue resistance and then a little bit past. Good. Okay, so that feels good. So now we're going to do the same thing on the other side here. Off the end of the table, this leg you can kind of relax if you want to keep it up wherever you're most comfortable, but I'm going to take your left leg, okay? And just relax it right into my hand. Just let it fall. Perfect. So now I'm just going to poke around a little bit in the back of your knee. I kind of need to get through your gastroc here, your calf muscles, to get right close to the bone in order to move that tibia in and out, okay? So first we're just going to assess what kind of motion you do have. So tissue resistance and then a little past. Good. How's that feel?
Fine.
Do you feel a stretch in the front or anything?
Yes.
Okay, cool. So now we're just going to do some oscillations. So I'm essentially just going to kind of do small little bounces back and forth, but all the way at that end of that tissue resistance, so it might get a little uncomfortable. We're going to do 3 sets of 45 seconds, so you will get a break in between, okay?
Okay.
If anything starts to bother you, start to get any numbness, tingling down your leg, let me know, okay? No history of fractures or anything here?
No.
Perfect. All right, so we're going to go ahead and start. So we're at tissue resistance, and we're just going to bounce. How's your weekend?
Good.
Good? Good. You know, stuck in this quarantine. How are you feeling?
I'm fine.
Fine? Okay. Feeling a stretch towards the front of your knee?
Yes.
Perfect. Not too much pain from me pushing, right?
No.
Awesome. Doing great. Okay, a little bit longer, and then we'll take a break and we're going to do 2 more sets, okay?
Okay.
And then we'll see how well you can straighten that leg, and we may have to do a little more.
Oh boy.
Okay, great. Now we're going to take a break. Good job.